Hey guys, Yuri here from Infinite Longevity. Today I want to talk to you about estradiol or estrogen and its relationship with testosterone. Now, as we all know, estrogen or estradiol, as it's better known as E2, is a primary female sex hormone, but men also have that hormone, and it does play an essential function in terms of spermatogenesis, libido, and erectile dysfunction. So you don't want to be too low or too high on the scale of estrogen. For men, the laboratory range will have you at 15 to 60 as a normal level or estradiol. But actually the optimal would probably be around 20 to 30. Okay, so that's important for men. And also the two hormones, testosterone and estrogen, have an inverse relationship. Okay, so the more estrogen or estradiol you have in your body, the more likely it is that your testosterone levels are lower. Okay, and that can present a whole bunch of issues if estrogen is in fact a dominant. You have estrogen dominance. So some of the issues with some symptoms of high estrogen in men include fatigue, sexual dysfunction, low libido, decreased morning erections, benign prostate hyperplasmia, which is, an increased, enlarged prostate, which in fact will cause frequent urination, particularly at night. Gynecomastia, which is enlarged breasts in men, increased abdominal fat, loss of muscle, depression and anxiety, and eventually it may lead to insulin resistance and even type 2 diabetes if left untreated. I had some personal issues with this. I have some experience. When I went to the doctor, my testosterone levels were actually fine, but my estrogen levels were never checked. And I was experiencing certain symptoms of high estrogen. It wasn't until I went to a different doctor who was competent enough to run both testosterone and estrogen labs. Okay? And one thing that was brought to my attention that a lot of physicians don't pay attention to is the testosterone to estrogen ratio. Okay? So the perfect ratio would be, or the ideal ratio would be something like a 40 to 1. All right, so for example, if you have a ratio, you could have the same exact estrogen level and feel completely different, or the same testosterone level and feel completely different because you may have more estrogen at that point, if that makes any sense. So very important ratio to keep in consideration when you're asking your physician or endocrinologist to run those hormonal panels to include those tests. And that's definitely something that you have to really bring to their attention. So definitely very important. And in my case, estrogen levels I was able to decrease them naturally, okay? And my testosterone happened to increase after I was able to decrease my estrogen levels. This is actually one of the problems with TRT, testosterone replacement therapy, which unfortunately a lot of physicians prescribe as a treatment to low testosterone. Now this is a entire topic for another video, but unfortunately a lot of physicians prescribe TRT therapy for patients at a very young age. Even guys in their 20s are getting TRT therapy before considering alternative options or looking into what their other problems may be, what is actually causing their low testosterone. Because, and I'm not, don't get me wrong, I'm not against TRT in any shape or form. You know, for older men in their mid 50s and up, sure, TRT therapy may be a good alternative, you know, for erectile dysfunction, or if they're feeling, you know, fatigued and centripetal obesity, insulin resistance, or all sorts of things. So, but for younger guys like myself, and even younger, I've heard guys in their mid 20s. I get, and you know, this is what the medical industry likes to, you know, make money from. So they prescribe low doses of testosterone as a form of TRT treatment. But as you know, the lower doses soon become, you know, you soon have to increase your doses, because your natural testosterone production actually shuts down when you inject with synthetic testosterone. Okay? And you would in turn need a higher and higher dosage of testosterone to achieve the same levels of testosterone that you would in the past. It's sort of like you know, like a diabetic. Once you start using insulin, okay, it's a you know, never-ending road. You will need more and more insulin, higher and higher doses of insulin to achieve the same result. So and you know, TRT certainly has its place. You know, it certainly has its function, but more and more I see physicians prescribing TRT, not even considering, you know, checking other blood work markers such as estrogen. Very important. So, and even not even trying, not even attempting to lower estrogen levels naturally, you know. And by the way, TRT, not only does it shut down testosterone production, in a lot of cases it would actually increase your estrogen levels too. Okay, so it creating a vicious cycle, an endocrine nightmare in certain cases. So now I'm going to tell you a little bit how to decrease your estradiol or estrogen levels naturally. You know, the obvious one is avoid estrogen-rich foods such as tofu. You know, licorice is actually another popular one. Avoid high-carb foods. So the foods that would lower estrogen would be cruciferous vegetables. This is what the first thing that my doctor told me. Cruciferous vegetables such as spinach, broccoli, Brussels sprouts, cabbage, because they contain high amounts of glucosides, which are natural estrogen suppressors. Okay, exercise, weight loss. If you're obese or overweight, reducing your weight would actually lower your estrogen levels and boost your testosterone levels. That would really be a major factor. Increase your intake of vitamin B12, betaine, folate, and choline. These are nutrients which will naturally help you lower estrogen, and you can get these in supplement form, and they're also found naturally in fish, in eggs, especially the yolk part. Don't neglect the yolk. That's the most nutritious part of the egg. Fish, meat, beets, great source of these nutrients. The other one is a DIM, is the proper scientific name is dilodamethane. Is a DIM is its most commonly known. If you search for DIM, you will find that it's a very powerful natural estrogen suppressor. Certainly worth considering. So definitely look into these issues, and please get your blood work checked. I can't stress this enough. If your primary physician is not testing your estrogen and testosterone levels, a complete male hormone panel, you have to let them know. Sometimes you have to ask for it, and if they refuse, it's time to get a new doctor. What can I tell you? But this is very, very important. Get these checked several times a year, and as you make progress, if you're feeling better, repeat your blood work. If it's not working, only then maybe you would consider pharmaceutical treatment such as TRT, but definitely check it out first. Okay. Check out my website infinitelongevity.com for a free ebook on natural sleep hacks. Like, comment, subscribe. See you in the next video. Thank you.